Hey everybody, this is the part 2 of the parts 1 and 2 ketamine infusion treatment videos. I put up the before video. I honestly didn't like how that one came out. I didn't like how I was stumbling trying to find or remember certain points that I was trying to make. So in this video, I'm going to try and make it more of just a rant style. Whatever comes to mind about my experience is what I'm going to say. Hopefully, I cover everything. So I just got done with my 6 sessions at Rocky Mountain Mind and Body Ketamine Infusion Clinic over in Inglewood, Colorado. Um, I don't recall the exact titles of the people administering my treatments, my infusions, but when you show up to the clinic, I've already done my initial consult with a clinician, so they knew on paper what I was there for. So it was just an introduction. Hi, welcome to the clinic. Here's how it's going to go down. They explained to me the dosing of how they administer your initial treatment, and it's 0.5 milligrams of ketamine per kilogram of body weight. So if I'm 200 pounds, I'm 90 kilograms. So 0.5 is 45 milligrams for a 40-minute long infusion. The appointment times were 90 to 120 minutes, but that's just honestly a lot of that is just getting in the door, doing your initial hey, either how was your last infusion, or what do you hope to accomplish with today's infusion. You kind of talk with whoever's doing your infusion that day, who's ever sticking you with your IV. You talk about the dose. You do, outside of your first administration, you do have some say in what your dose is. If you want to make a big jump, you can make a big jump. If you want to jump a little bit, if you want to stay where you're at, that's all up to you. You're the patient. You're the one paying for the infusion. I mean, they do have, obviously, they can advise. It's their whole job. They know the parameters, but if you feel, because you're the one undergoing the experience, that you want to play around with those doses, you absolutely can. I had no prior experience with ketamine, so I let them dictate basically my first 4 to 5 infusion doses until I got a better feel for what I was doing. That initial dose, that 45 milligrams for me, in that 40-minute infusion window, because the time before and after, like I said, is just pre and post consult and hooking you up with the IV and making sure you're comfortable. And they get you a blanket, you recline you in your chair, and they get you headphones and your Bluetooth hooked up, because music's pretty important with ketamine infusion treatments. I'll get into that. But so my first dose, my first session was, I went in obviously anxious, because I'm usually anxious with any new substance that I'm putting into my body that I'm not familiar with or I haven't done before. I'm always a little anxious, especially if it's something that's gonna put my brain or my headspace, my consciousness into a place that I have never been. So obviously I think anxiety is pretty normal in that regard. But it was really gentle, honestly. Ketamine at 45 milligrams per kilogram, or 45 milligrams total, in that 40-minute infusion time was gentle. To me, it was very, I'm shaking hands with this molecule. I'm meeting this molecule. I'm encountering this personality for the first time. And it was very, if I could start to describe a psychedelic trip, or a dissociative state, it was very it was very white. Everything felt very cottony and cloudy and comforting and warm, and just there was nothing aggressive. It didn't move too fast, and I was just in a floaty headspace. And I mean, I'm not going to try to get too complicated with trying to explain a psychedelic state, because it's near impossible. But it was nice. It was easy. My anxiety surrounding what ketamine was going to be to me kind of fell away. So I was like, okay, cool, that's ketamine. Post consult, they asked me how I was doing. I was like, it was nice. It was gentle. It was easy. And they were like, cool, that's basically what we want to hear from a patient for the first time. You felt exactly what we were hoping you would. So we're going to jump you to 60 milligrams for your second one. So an immediate 20 milligram jump for my second infusion. So that was Monday. Tuesday break, and then Wednesday I come back for my second infusion. My second infusion, pre-consult, they come in, they're like, how you doing? Did you like your last infusion? Okay, we agreed 60 milligrams. You ready for that? Yes. They hook you up, bring you a blanket, headphones, all that. You set you up, get your Bluetooth going. And this is only my second infusion, but I noticed right off the bat that dose means a lot obviously, with any substance, but dose, that 20 milligram jump was a difference in comparison to the 45 milligram dose. Saying that, I mean that it was, there was a little bit more of a, not a fight, it wasn't a fight, but it was more of a allowing the trip to move faster and more aggressively. It wasn't just so comforting. It was more like, we're going to pick up the speed now. You know, you might pick apart some thoughts here and there. They weren't super deep epiphanies. They were just, you know, you'd think about something and move on. But I recall dissociating a little bit to where, you know, in a psychedelic state, sometimes you're unsure, you can become confused of what's going on. So I started to, you know, what I would say, like white knuckle a little bit. I'd be questioning in my head amidst the psychedelic trip that, you know, did I do something wrong? Am I doing the right thing? Is this what I'm supposed to be doing? You know, you start to get a real overwhelming sense of like right and wrong. And though that may seem uncomfortable, that's actually when the work is happening. So, and you become more familiar with that the more you work with psychedelic medicines. So, you know, the trip, it peaked, I came down, I came out, I came back to sobriety, and I started to notice that that's how it's going to work. And because now I have, you know, 2 points make a line. First and second infusion, I've noticed that it takes about 10 to 15 minutes to even kick in. You know, you become a little more drowsy, a little more, inoculated is not the word, maybe inebriated. You're laying back and you start to feel it come on, and that's when you kind of start to allow or accept the idea that you're going into the experience. And then you go into it, and it gets faster and faster until you're basically at your peak, and then you ride that peak for the duration of the, you know, the canister of ketamine that's being fed through your drip. And once it's, you know, runs out, you start to come back to baseline. You come back to sobriety. And I noticed that because you have the option to wear a blindfold. I never took the blindfold. I like to have the ability that if I want to open my eyes, I can reground myself, you know, with my environment. So I left that option open. So I would open my eyes, and there was, you know, paintings in the room that I would stare at those. And if those weren't fucking swirling anymore, I knew I was coming back to baseline. So I came out of that one. They came in, they talked to me, they said, you know, how'd it go? I was like, well, it was a little more aggressive, but it wasn't bad. It wasn't bad. It was just dissociative, which is exactly, you know, what ketamine is. It's a anesthetic dissociative. So, you know, day goes by, I come in for my next treatment, and they decide that, you know, they want to up me only 10 milligrams. So I'm at 75 now. And I was like, yeah, perfectly acceptable. You know, if I white knuckled on 65, let's see how 75 goes. So third infusion. And I noticed this time, again, because I'm becoming more and more familiar with how this molecule interacts with my body and my mind, that 45 was easy, 65 was a little white knuckly, 75, I just allowed it to do its thing as opposed to questioning it. And it felt more graceful. It was faster. It was, again, more intense, but it was less uncomfortable because I just allowed it to do what it was doing. That cliche fucking saying of, you know, just witness, just allow, just watch your thoughts, don't cling on to them. Like, when you can finally actually understand how to do that in a headspace, a psychedelic headspace, things become much easier because you don't want to fight it. You don't want to wonder. You don't want to start to latch on to caring if you've done the right thing or not. That's not the time to do that. And it's much easier said than done, obviously. But at my point, I've been able to do that. So at the 75 milligram dose, I let go. And, you know, again, this is where words will start to fail, because the deeper you go into a psychedelic trip, the less language will support what you're trying to explain back in sobriety in the real world. So when someone's like, what was it like, you know, when time and reality fell apart and what's all that shit? What basically starts to happen is you go into your deep, deep mind, and you will have epiphanies, or you will latch on to certain thoughts, and you'll really start to dig at them, and you'll either try to figure out the root or decide that you don't care about that thing anymore, or you'll have an epiphany about something else in a way that you've never thought about. When you're able to dissociate from your normal state of thinking, you can start to reinterpret or find a new perspective on things. So that's what would happen in rapid succession. You're in a completely different linear line of thinking where you don't think at the same speed as you normally would in sobriety. So at 75 milligrams, I was having more epiphanies. Um, but it became exciting. I think that's when I started to notice that the ketamine experience can be, and for me, is exciting. I like it. I really like that headspace. Not in the like, weird addicted, like, oh my God, I need to fucking get back there again. I need ketamine. Like, it's not at all. It's just, I really like that. If I had the option to get hooked up every once in a while and it wasn't a little out of my pocketbook, then I absolutely would, just because I enjoy it. So, the weekend goes by. I'm back for Monday's follow up fourth appointment, which was another 10 milligram jump. We went to 85. And of course, I was like, yeah, let's do that. So, we're going up at a controlled rate, 10 milligram jump every time. And at 85 milligrams, this is where I started to notice the experiences were zigzagging. First experience, good. Second was white knuckle. Third experience was better, graceful. Fourth, increase in dose, it can still catch you off guard, So even though I was wanting to allow, I'm still in the realm of a substance that can be dissociative and can, flip you over if it wants to. You can have all the experience in the world with allowing and witnessing, but a substance that is dissociative by virtue will or can dissociate you. So amidst that trip, it went not bad, but it was a little less positive than neutral for me. So, we went through that, and there's like a call help button that you have on your, if you really need someone to come in and help reground you, reorient you, or to stop the drip of your ketamine infusion if it's too intense, you have a call help button. You can push that if you want to, and they come in immediately. So it's nice to know that you have that option. I didn't think I needed that, even though it was uncomfortable. I decided, that, again, I've been through this enough times that when things are uncomfortable, that is when work is being done. Because that is when you're revisiting or visiting something that does make you uncomfortable. And if it does make you uncomfortable, it's something that needs to be worked on. So I just allowed that. It wasn't too ugly or too nasty, too gnarly for me to handle, so I allowed that. And that lasted the duration of that experience too. Like, it didn't clear up. So at the end, it was not great. And when I came out of it, that was the first time actually that I had a physical sense. Even in sobriety, my headspace was cleared, ketamine was out, but I was physically like vibrating, like aggressively. And my administrator, the person helping me with my infusion, came in and she was like, are you okay? And I was like, well, I can't stop vibrating. Like, why am I doing this? And she was like, oh, ketamine has this attribute or effect sometimes where it can activate your fight or flight, your parasympathetic nervous system. So that's normal, and it's okay. And I was like, okay, well, how long does this last? And she was like, it can last probably it's possible to last the duration of the rest of the day. And I was like, fuck, like I got shit to do. But thankfully, like, mine cleared up within like a half hour. I just sat in the clinic again. That's why they allot you that 90 to 120 minutes. Like, if you need that recovery time, you have it. So mine didn't last that long. They can give you a little bit of food and water afterwards to help settle you, and it does. It slows like the effects. They don't want you to eat or drink beforehand because you can get nauseous, and you don't want to be nauseous and having to throw up in the midst of a psychedelic experience. Ayahuasca aside, it's not fun. It's not great. So, not advised. So after my fucking physiological vibrations started to slow and I was able to walk out, I let them know that, like, hey, it was a more harrowing experience, but it was not bad. And they're like, well, it's okay, and it's not bad that you're experiencing both sides of the spectrum. That's actually what we do want to see in clients or customers or patients, is that they run the gambit. They have good experiences and they have bad experiences, because you want to be able to see like the totality of everything, because not everything's fucking gloom and doom, but not everything's perfect either. So it's okay if you run into some hardships and you also have some good experiences too. So again, just gathering more knowledge and experiences on ketamine. Come the following infusion, that following Wednesday, my fifth infusion, we jumped another 10, went up to 95 because I felt personally like there's no need to make big jumps. It's gonna get more intense every time, regardless of how much we're climbing. And if 85 is already intense, why be stupid with it? So let's just make another 10. So we go to 95, and this is when I started to like dial in my playlist. What I found with ketamine is that music is pivotal for these infusion treatments because though the ketamine is going to do what it does to your brain, you at least want to be in a headspace to be comfortable allowing the ketamine to be doing what it's doing. Music helps tremendously with that. I thought that I had a playlist that I liked and ready for ketamine infusions. It's got, you know, it's like homework music. It was like relaxing stuff and some like there's some rock stuff in there, but it's like mellow rock. And I was like, okay, this will be okay for ketamine. And some of those songs, when they come on in the midst of a trip, it is not what you want. Your weed music is not your ketamine music. Your mushroom music is not your ketamine music. Your homework music, your relaxing, sleepy music is not ketamine music. It's not what you want. What I found with ketamine is that because ketamine moves so fast in the brain, like how I describe it is ketamine is motion. Ketamine, I felt like I was being thrown at hyperspeed through like eraser shavings of like TV static. It's just and like or like really fine granules of sand. They explain it as like you don't see images, you don't hallucinate things when you're on ketamine. You see textures. So I would see like fabrics or clouds or silk or fog. Like you're in an atmosphere. There's no body. You're just in a place that is rapidly moving and it is loud via motion. So with the music, you still have audio input coming in to your head, and your brain's going to try and process that amongst your experience. So every 3 minutes or 4 minutes or however long a song is, you want that 3 to 4 minutes to be something that is aligned with what ketamine is doing. So I found that fast music that is also upbeat, because you don't want anything malevolent sounding or ominous. You don't want creepy shit coming in. And rock music, the chords come in very clunky. They don't sound right, and it just sounds like unorganized noise in the ketamine headspace. So do away with that. I didn't try rap, but good luck with rap. You're not gonna understand a fucking thing they're saying. And anything mellow or too slow, or if the buildup is too long, or if you don't have a fade between songs, you don't want a gap in time where you feel disoriented, like nothing's happening, because then you will become you get confused for a second. So you want seamless building, epic, almost like movie music. So I have my playlist finally dialed in for that. And for my fifth experience, because I had my playlist perfect, it carried me through like the loud, fast, aggressive pace that ketamine can be at a higher dose. I was still having my epiphanies, in my head. I was running through my personal shit, and the music the music carried me through the experiences. The music made me feel like what ketamine was doing was important, because that's just what the feeling or the vibe that the songs conveyed. So just make sure your playlist is on point. But overall, like my fifth experience at that 95 milligrams was epically great. So again, when I was saying I zigzagged every experience, first was good, second was third was great, fourth was fifth was this is fucking sweet. And again, back and forth. So coming into my sixth infusion, and I just capped it at 100. Like we don't need to go 105. Let's just do 100 milligrams, and just whatever it is, because 95 was good enough. So why go? You don't in psychedelic space, you don't want to get over cocky or overconfident and think that, oh, let's go 120, let's go for the big shebang, because you don't want to be in a deep ass water headspace where that riptide will suck you out from underneath you. If you're not prepared, you don't want that. If you can't spit it out if it's in. So really jumped 5. I did the 100 milligrams. I felt like that was appropriate, and I expected, because of the zigzagging pattern, that this was going to be a a worse experience or a harder one. But again, music was on point, and I had become very comfortable with the whole process. The only part, it's funny enough, all my tattoos I just don't like. I don't like needles. I don't like medical. I can get shots just fine. I fucking hate getting IVs. It's uncomfortable. It hurts. It sucks. I don't care what you say. Fight me. Um, but so I'm hooked up to that. I'm not liking it. I don't like this fucking needle in my arm, and I'm thinking the experience is gonna be bad. But it was good. It was really intense. It's supposed to be. They say that they change your dose every time with ketamine, and they climb you up and allow you to assess it how you feel because they're trying to find your sweet spot. There's a point where too little is too little and too much is too much. So they try to find your sweet spot, and only you can be the dictator of what that sweet spot is. That sweet spot with a psychedelic is a dissociative point where you're not overwhelmed, but you are removed from your normal state of thinking to the point where you can call it ego death, you can call it ego dissolution. The ego is the thing that basically drives us in our everyday life to make us think and do what we do. The ego has a job. It's to keep us alive. It's to keep us going. It's to keep us to amass as much power as it can for security purposes. So psychedelics will disarm and dissociate that, sometimes obliterate it completely if you go deep enough. And that is when you will enter what some people compare it to a near-death experience, because when your ego thinks it's dying, you think you're dying. And that's when a lot of people will panic unless you've been there before, because it's not normal. It's not a normal state of being. But with the ego out of the way, so are all your filters of bullshit and your preconceived notions and all your things that you think are your problems. You're able to work around that, all the illusions of it, and really troubleshoot. So they're looking for that sweet spot. They're trying to find what dose of ketamine for your brain specifically is going to give you access to that level of ego dissolution to where you can effectively get work done. I can't say for sure if 100 milligrams was that for me, because the way I'm able to interpret if I've gone deep enough is that if I'm still in control, if I can still identify myself and my body and my mind in that headspace, then I haven't gone deep enough. If I haven't lost complete mental awareness, me personally, again, a lot of different substances and a lot of experience, I don't think I've gone to that dissociative level. Even at 100 milligrams, I was hyper aware of the insanity going on in my mind, not in a bad connotation, but that hyper speed psychedelic headspace, I could still identify and string sentences together that I am so and so, I'm at this clinic, I'm undergoing this process. If I could still think of those things and identify myself in that place, I don't know if I had hit that dissociative state. But I've had a lot of people ask me periodically through the treatments, and I wanted to wait to the end to answer any of this, but did you like it? Would you take away from it? Do you feel different? Did I like it? Yeah, I did. I wouldn't trade back the experience at all, any of them, and I would do more if I just had an endless pile of money. Did I take anything away from it? This is where my experience differs from a lot of other people in that I'm not like most other patients who are going into the clinic who actually need it for a lot of mental health reasons. I've done a lot of that work and unpacking on my own with other substances already. I constantly do. I post often because I'm in that world often because I'm working on my own shit often. And so when I enter bigger things like this, I don't have an entire house to unpack because I've etched at it day by day, every day for years now. So I didn't have a big traumatic thing to unpack. For me, it was more of that, what I said in the first video was that psycho-spiritual exploration. I wanted to explore the molecule, and I wanted to derive any benefits from that molecule that I could, so I did. And what I took away from ketamine, those experiences, were a couple epiphanies. I'm not going to jump into that because that'd be a fucking hour-long video by itself. But I had personal epiphanies, and what I noticed mostly was a, I wouldn't say drastic, but it's a noticeable uptick or increase in mental acuity. I am better able to recall words that I want, string together sentences that I want. I've noticed it in my, I'm in school right now. We have debate oriented classes, or we have to cite things, or shit, it's a lot of discourse. So I'm better able to substantiate things that I want to say or elaborate better. And I noticed that in between my ketamine treatments. So there's a mental acuity uptick. And I mentioned that to the people administering me my infusions. And they said that is absolutely normal. We hear that from people all the time, that when you go through ketamine infusion treatments, that your mental clarity is noticeably increased. For how long? I don't know. Do I like that? Absolutely. Um, do I feel different? And I think people want to know, like, did it alleviate any anxiety, or because I don't have a lot of depressive issues anymore. Um, Again, I'm always anxious because I have always got shit going on. There was one of the major takeaways that I took from ketamine is that I think when people go in to a psychedelic, they convene with a big medicine, whether it be Aya or mushrooms or peyote, whatever you're trying to do to fix your brain. They Your brain is fucked usually because something is stressing you out. And whatever is stressing you out is a real problem in the real world. And when you take that substance, that problem doesn't go away. What changes is how you're able to view that problem and what you want to do with it. So as I'm sitting in the middle of, I can't remember if it was my fourth or fifth, but during my infusion, I was thinking about the shit that stresses me out: money, school, work, personal relationships. And as I'm getting this massive download from ketamine and tuning my brain, I'm realizing that my problems aren't going anywhere just because I'm doing ketamine. Those problems are staying in the real world. So the ketamine doesn't make your problems go away, but it's going to shift how excitable or impressionable you are of those problems. And they make you elaborate, or dig into, what do you want to do about those problems? Are you handling those problems as effectively as you could be? What are your other options? Is it actually that bad if you go with option C over B or D? Like, it helps you troubleshoot what the fuck is going on in your life. And that's what I took away from ketamine, is better, more effective thinking, and maybe a percentage calmer state or baseline of being. So am I still anxious? Absolutely. You're always going to be anxious. Anyone's always ever going to be anxious, because humans are anxious because we always have things going on. And if you're not anxious, it means you don't care about what's happening. And that's a problem. So post infusion number 6, they basically ask you, like, if you want to couple it with therapy, and you can. Therapy helps a lot of people. It helps people. It's called reintegration, essentially, is what shamans and other plant ceremonies will call it, is reintegration. You blow your mind open, and all of a sudden you have a lot to think about and a lot to say, and not a lot of people to connect with about it, because people don't understand what the fuck you just went through, and you can't describe it to anybody. Now you feel alone, and therapy helps people because now you have a trained therapist, hopefully in a psychedelic awareness type of setting, where they understand that either you just did like ketamine or MDMA or something, and they can help you navigate life after that experience. I personally don't feel like I need that, but I don't know. There's no special way for me to like wrap this up. It's just, I had 6 sessions. They varied in dose. I took away some epiphanies. My brain works a little bit better. I would do it again. I didn't have any trauma to treat. Would I advise it to other people? 110%, yeah, because other people are on these other bullshit avenues of trying to figure out their life, whether they're on fucking prescription medications, SSRIs, that actually don't treat your goddamn system. They just supplant your brain with, instead of depressed, you just feel fucking numb. I personally can't stand it. There are other avenues, psychedelic avenues, that are medicines that will fix and treat and heal your brain if you have problems that you feel like you can't handle on your own. Taking these traditional path medicines that have not been proven to work effectively. They don't fix your problem. They just extend it or numb it, and they just treat symptoms. They don't treat the core, the root of the problem. These other medicines do. So yes, I would absolutely suggest it. I advised one other friend a while back to try ketamine. He did, and I don't want to misquote this, but I believe he had combat related PTSD, and he effectively treated that and said it made him feel better. So anecdotal, I don't know. Arbitrary, I don't know. But per his claim to me, it did work, and I liked my experience as well. This clinic was professional. They were very kind, very accommodating, very informative, and I appreciated that. So I wouldn't take the treatment back. And I would recommend it to other people looking for an alternate route of healing if you're dealing with anxiety, crippling depression, treatment-resistant depression, PTSD of any kind. Yeah, give ketamine a shot. It's a couple grand, but to fix your fucking brain and change your life, I think that's a drop in the bucket. And it's way cheaper than getting a passport and flying overseas to do something as monumental as ayahuasca. Ketamine clinics are right next door. In a lot of states, just check your legal availability and see what's closest to you. I'll end on that note. I'm a little over a half hour right now, so hit me up with any questions. I can refer you to different links. I have a wealth of information on this topic, so just let me know. Thanks.